am joyously joined by Dr. John Kim, an incredible pharmacist today, who brings with us so much knowledge and information and also an amazing sense of humor. So I'm really excited to have you here today.
Michelle, it is an honor to be on your podcast. I thank you so much for your invitation. I know we are so close by, but too bad we can't do this in person. But next time we will do something in person, maybe in the middle of New York City in a restaurant somewhere, breaking bread, gluten-free bread if you can. And definitely.
We are going to talk about detox and drainage and what I think for a lot of people are buzzwords in the kind of biohacking and natural health space. And you are going to give us the real information behind it. We're going to talk through kind of how nervous people should be about environmental pollutants, how real the threat of those are, and what we can do for our health should we encounter them. And then also, you have such a powerful stance on elimination diets, as I do, which is there's a time and place for them. So I want to get into that too.
Hey, my name is Dr. John Kim. I'm a functional medicine pharmacist. And from the get-go, when I first started doing functional medicine, I started doing hormone consults. That was the reason why I got into this entire gambit of so-called functional medicine. At that point in time, when I started out back in 2008, was called holistic medicine. That was it. I mean, we didn't really talk about functional medicine. And then at that point in time, that's when centers like A4M just started their functional medicine fellowship training. And I was probably one of the few pharmacists to be involved in that gambit. And then you had all the MDs, DOs, nutritionists, and PAs getting involved and really learning together. It's really fun. But when I first started out, it was just on hormones and how to manage hormones by giving hormone replacement therapy. Nothing
and that was
more.
As early as, you said 2008?
2008.
Wow. So that was very seemingly ahead of the mainstream, and probably, I'm assuming you faced a lot of criticism, because even I feel like bioidentical hormone replacement therapy now is still considered very taboo. Is that true? Is that what happened?
I don't think it was as taboo as back in the day, because when we first started out, there was no real regulation or any of that nature. So a lot of physicians just push the envelope into whatever they want to give. And that was also a problem.
Oh, yeah.
Right? There's certain doctors end up having to give super physiological dosing on hormones, and then thinking that just optimizing estrogen, progesterone, testosterone would do the trick, and including thyroid. I've seen overcorrected thyroid all the time, not looking at the entire picture of possibly gut issues, looking at detox pathways, cortisol mismanagement, sugar issues, stress response, poor eating habits, all these things that now we're looking at much more. They weren't even teaching that as much, except for, hey, if you look at the labs that's looking like this, you give this much of hormones. If you see this type of cortisol issues, you give this supplements, and nothing more in terms of looking at deeper things that I'm looking at nowadays. And I learned a lot of mistake based on those mistakes. Absolutely. And so if you talk about hormones, endogenous hormones and such, I'm all there. The thing is, do you really need those hormones optimized to a level that you don't really need to be done, except for what are we looking at? Your lifestyle issues. Are you sleeping correctly? How's your relationship? Right? How's your diet? Are you taking care of yourself? Right? How's your work schedule? All these things should be done holistically, even before getting through in terms of hormone issues, even detox for that matter. And so I call this the foundational care that needs to be managed before you do anything.
When patients are going into their office and let's say they do have a thyroid issue, the thyroid issue is being regarded as a very diagnostic and medication focused approach, right? As the solution, essentially. So it's like, you have thyroid problem, here is thyroid medication. And what you're saying is, through all of these years now, 15 years of you working with people, you've seen that it's so much more complicated than just a one pill solution. And you would expect of all people as a pharmacist, for you to be pro only medicine. And certainly you found it's not enough, and it's certainly not the root cause treatment for a lot of hormonal issues.
It's not. And I made that mistake early on. I thought just for me, and I traditionally been trained as a compounding pharmacist. So I own a compounding pharmacy and a lab right now. And so my overall main business before was just dispensing more prescriptions, right? More prescriptions, more cells I'm having to provide, more help I'm going to make an impact on these patients, and they're going to feel better, which I thought was the main factor. But that's not the scenario. Majority of patients, that if you want to just break down thyroid hormone, for instance, majority of patients that are coming in, they actually have a elevated TSH for that matter, but just look at the TSH doesn't give you the full picture. And this is the main fact that I end up having to always rant about. Why are doctors still looking at TSH issue instead of the fact that let's look at the entire breakdown of the thyroid hormones, look at the free and total T3, T4. What are we looking at? TPO, thyroid antibodies, right? Reverse a T3, I'm like, do we really need to look at it? It's only going to show you that there's an underlying issue. What is underlying issue? Stress, dummy. that's a lot of times, or inflammation. So like, do we need to look at that? Probably not. And then you're looking at TSH, but TSH is just a marker saying that, hey, there's a poor regulatory aspect that's going on within your pituitary gland and everything else that's going on. What is the root of the issue? A lot of times is the fact that they are missing key micronutrients, electrolytes, right? They're not eating well, they're not sleeping well, they're not taking care of themselves correctly, and they're completely burnt out. And majority of times, dealing with poor cortisol issues, let's just say they have an adrenal fatigue problem, that end up having to show as a similar symptoms as poor thyroid function. And so majority of times, if you fix the actual nutrient issues, if they eat well, take care of themselves, including getting the proper sleep management taken care of, and then having to manage their cortisol and the stress issues and the sugar dysregulation, thyroid actually comes back normal. So do we need to fix the actual thyroid issue with thyroid medications? Probably not. But you have to also looking at if the thyroid is not being managed correctly, even though you did all those things, then the next step is, are we going to be looking at toxicity? Are they using the right form of water that they're drinking? Or they end up having to deal with certain heavy metal toxicity? What is a profession? All these things. I mean, I have a part-time pharmacist that he works for me, but he's a nuclear pharmacist. So he actually works with nuclear items. So he needs to get checked properly, right? Exactly. So all these things needs to be asked. But thing is, like, trying to throw everything all at once, probably not the best choice to do it, nor are we end up having to throw just medication alone with the trick either. So there's a right amount of diagnosis, but also clinical management that practitioners need to look at properly. I think that comes from overall experience.
Sure. Yeah.
And as well as mistakes that they made before.
You also have to unlearn a little bit, I'm assuming, about what you're learning in a non kind of holistic or functional capacity, because quite literally the gold standard test for thyroid function is TSH. That is what is used by medical doctors. So it is, I mean, not every medical doctor, that's a gross over exaggeration, but I'm assuming that what you learned in your medical schooling was really focused on medication management for thyroid issues. When did you start to see the bigger picture? Was it just working with patients and just seeing, hey, they're not getting the results, or they're not actually feeling better, even if their TSH is better? When did it kind of like switch for you?
This is the light bulb moment that I actually had, was when I just followed didactic protocols that they gave out at the A4M and having to make few mistakes. And I'll give you a perfect example. I had a patient who was dealing with adrenal stress issues. And then one of the key supplements they actually recommend for cortisol management was giving rhodiola.
Sure.
Right? Simple, like everybody could use it. It could end up having to help manage your cortisol level and such. But they never taught us that there's a genetic SNP issues when we're dealing with rhodiola, right? Mm. And that patient actually had the most severe hot flashes taking rhodiola. Right. So that was one of the things that I just had an aha moment. I can't be utilizing all these things. And then another thing that actually ended up having to really make an impactful moment was I had this patient who was very overweight, and having to have the same discussion every single time, every single month we're discussing about her hormones. She always says, during the midday around 3 p.m., I feel like my eyeballs is going into my skull. And then I have issue with lights and then all these things. And then I never bothered to ask what kind of lunch did she have. She would conveniently go to McDonald's, order a Big Mac, right? Because her son, who's 5 years old, wanted kids meal, right? So that was basic convenience factor, but never factored in terms of that's causing a lot of toxicity. It was causing a lot of sugar dysregulation on top, right? So what is the whole point of using hormones, or even bother to give bias cream to her? At that point in time, we were dispensing bias capsules. I would never dispense estrogen capsules from now on. But at that point in time, you just learn from the issues, and then you just had this moment of all that education I got, all that training, it's not enough. I have to really dive in and then learn on my own, and then really develop a right methodology that really resonates for me and then the future clients I want to work with. And how do we get these patients correctly balanced without utilizing hormones if they don't need to use it?
You do understand that you are not like most people, though, right? Like, a lot of people do push drugs first and then lifestyle solutions later. So I just want to commend you on that and appreciate it. And also, it is from your lived experience, and it becomes, I've worked with over 1,000 clients, and it becomes very obvious, these things that you're saying, when you work with even several clients and you're like, oh, it literally just doesn't work. Like, it just does not work to only use medication solutions, which are completely necessary sometimes. But like you said, if you're highly stressed and your cortisol is blocking the conversion of your thyroid hormone anyway, it doesn't really matter how much thyroid you take, because you're not going to get any of the active form. Or if you're building up in toxins and that's making it impossible for your body to do the work it needs to do or utilize all these extra nutrients to get those out, you're still not going to be able to have those nutrients to build and produce the other hormones that you need. Take us through detox and drainage. You're kind of a detox and drainage king, so you have to talk to us about it.
So detox wise, it's, everybody talks about detox. Everybody's like, oh, you could do a weekly detox or annual detox, or you could do this, you could do water detox, and all these things that's going on. But to get all to the root of the issue with detox is, this is one thing that I end up having to ask is, what are you trying to achieve, right? What are you exposed to, and why you want to do detox, right? So that's the number one thing that no one asks about. There's so many influencers on Instagram talk about drainage, but what is a drainage, right?
Exactly.
So drainage, let's define what drainage is. Please. The drainage pathway is not really talked about in a conventional allopathic medicine, but in a holistic sense of that, it deals with some of the key points dealing with your liver. That's number one. Your overall bile, right? And then you're dealing with your kidneys. Your skin is also a drainage pathway. And then, so anything relating in your bowel, like key 5 things. So one of the things that I end up having to explain to my clients about is a dirty bathtub. Okay. So if you have a dirty bathtub and you actually have a clogged drain, and you have all that dirty water on top in that bathtub, it does not make a difference if you decide to scoop all that water out. Your drain is still blocked. And then they have like, oh, that's not what that means. So if you're not pooping well, if you're not sweating well, okay, if you're constantly having to deal with sensitivity issues to certain chemicals in food, even food for that matter, right? And you constantly having to deal with skin breakouts. Let's just, if you try to take a supplement for that matter, and you start breaking out, you have a drainage issues. And another thing that I ask patients to do is, do you smell?
Totally.
Right? Yeah. If you actively having to deal with bad breath, if you're actively having bad body odor, even skin rashes for that matter. I had a client yesterday, she messaged me, she's part of my concierge program, and she done phenomenally well with her entire mold issues. And out of her 3 months, I mean, she made so much progress. I mean, this is this person that really puts the work together. And but one of the things that I always ask is, like, during the follow-up is like, how are you feeling? How's everything else? She's like, oh, everything's fine. And then yesterday she messaged me and she says, not everything's okay. I have a rash going on under my armpit and right by my crotch area. I'm just like, that's fungal issues. So we still need to work on, are you sweating correctly? That's the main thing I was asking about. And she's like, yeah, much better now. But I'm like, okay, that could be a reason why you really didn't sweat as much, moisture, dark areas, right? You still have fungal overgrowth going on. We have to still work on the drainage issues. And so all these things should be the basic aspect of detox. But what are people trying to do on Instagram, all these social media pages? Sell their expensive detox kits that they believe, or they're trying to sell that everybody could use. Can Jane Smith, who doesn't sweat that well, can she tolerate a detox kit? Absolutely not.
And what's the risk of that for her? Let's say someone does take things that are potent detoxers. What happens if you're detoxing but not draining, let's say?
Yeah. So there's a term called Herxheimer. So it's coined by Dr. Herxheimer. Basically, it's a die-off reaction. It could be die-off from the endotoxins that's released by pathogens, or your entire body is basically dumping stuff out. I was about to say the S word, but stuff out.
You totally can on this podcast, by the way. It's a very safe space for cursing.
Good. You know, it's that New Jerseyness is coming out. You know?
Oh yeah, let it out, please. It's very safe to be cursing here.
But anyways, but you're just basically dumping out, and then you're just overloaded, and then you have release of histamines, and as well as your liver's getting blocked basically, and your bowels not flowing correctly. It's basically all backed up. So same terminology going back to the entire dirty bathtub. Are you blocked, right? Can you drain things correctly? Even though it says drainage, but I'm repeating the word, but can you drain correctly? Can you let things out correctly, right? Are you peeing well, right? That's another thing. People are not hydrating themselves correctly. And if they do hydrate, they're not replacing their electrolytes and minerals correctly either. All these people going into saunas, like, I'm detoxing. All right, great. What are you doing afterwards?
Totally. And also, as we know, detox is a process that it involves repackaging of toxins or hormones into different forms so that they can be easily drained out of the body. And when I think of detox in the like kind of old school way, we think of like juice cleanses. And I'm like, that's not, yes, maybe chlorophyll and other antioxidants have some capacity to support you throughout that process. But detox is actually a very highly nutrient demanding and energy demanding process. So when we think of detoxifying, I think a lot of people are actually thinking of drainage, like sweating and doing all of those things, but they're not thinking of what nutrients does our liver need to actually go through phase 1 and phase 2 detox.
Absolutely. And then when you talk about chlorophyll and then doing heavy metal detox, after doing a heavy metal detox, I mean, rightfully so, I recommend that as well. But what are you replacing that with afterwards, right? If you decide to just get the heavy metal out, the heavy metal is going to still come back in. But if you replace with the right minerals and balance things out, including fatty acid, we'll talk about pretty soon, that's where you have a proper management of drainage as well as cell membrane support, mineral replenishing, and things that's going to really give the better foundational aspect in managing some of the complicated cases that we might be dealing with. If a healthy cell membrane is very easy for you to detox, and then your entire body basically lights up, right? So you, especially dealing with mental fog issues, replacing the right amount of fatty acid can be very impactful for you to recover and function better.
I know fatty acids is a huge part of the protocols that you might have with clients, and which are all individualized, of course. So tell us a little bit about that and why fatty acids are so important and the structure of our cells is so important.
Yeah, definitely. I mean, that's one of the things that's really a missing point, because I don't think a lot of clinicians understand that concept, that you need to support the cell membrane. Because if you look at the cell membrane itself, it's actually comprised of 2 lipid bilayers, lipids, right? So when you talk about lipids wise, if you end up having to utilize certain powerful binding agents like cholestyramine for that matter, it does end up having to rip that phospholipids off the cell membrane. If you end up having to utilize drugs like statins, fenofibrate, any of these anti-cholesterol medications, that also affect the integrity of the cell membrane, but at the same time, it affects the electron transport chain of the cell membrane itself. So if you think about the entirety of the Krebs cycle, things that we actually learned about chemistry, that gets impacted as well. You need the Krebs cycle in order for our cell membranes to work correctly, in order for us to making glutathione, where does glutathione come from? It's basically an entire cascade of the Krebs cycle that's actually needed, right? All these things are necessary, but what are we doing at this point in time? We're just looking at micronutrient testing and then just randomly throw things because you're so deficient. What if I told you that deficiency comes from the fact that you have a root cause issue that's because the cell membrane is so piss poor and it cannot function that well? As a result, that's where the deficiency comes in. That is where the symptoms come through. And so if you don't actually take care of the hierarchical issue dealing with the fatty acid imbalance, you're not going to be able to fix the entirety of the issue on the bottom. And so that's the reason why I end up having to put the entire discussion of Dr. Robert Navia's work about cell danger response and why it's so important to looking at respecting the role of the mitochondria, the cell membrane, replace the right amount of fatty acids to calm the cell danger response, then, or at least together, in supporting the drainage pathway and then really walking the patients through the entire healing process.
So you would even say someone just taking liposomal glutathione or something like that, it might not actually be enough because you might actually still have a cell membrane issue. Even just glutathione itself won't be enough.
Glutathione actually is a great master antioxidant that I would recommend a lot of people. There's a key word, a lot of people, not everybody.
Right. Well, if people have drainage issues, by the way, and they get a massive Herx reaction from taking it, it's also not going to help them too. Right. Yeah, exactly. So that is also something that when right now what's very hot is to talk about the mitochondria. It's very popular to talk about glutathione. People are taking it, taking precursors, taking glutathione. But I think you bring another really important piece to this discussion, which is that we also have to focus on replacing those fatty acids too. That's essential.
Essential. But if you're looking at the entire glutathione, right, it's a massive antioxidant. It does a lot of things in terms of helping to detox, help to support your immune system, all that. And we know this. But when you talk about glutathione, there's a place and time to add in glutathione and what not to. And especially when you're dealing with certain mycotoxin patients, when you specifically talk about gliotoxin issues, you cannot be throwing glutathione at the picture because they already have sulfation problem. So those patients are going to act negatively with glutathione getting involved. And so you going to get an IV glutathione because you don't feel well, you're just causing more problem than anything else and causing more inflammation than anything. That's the reason why I don't recommend people just to listen to me or anyone else on Instagram. It's like, oh, you know what? That person recommended liposomal glutathione. Really? I'm like, is that rightful for you? Does that $75 or $90 liposomal glutathione, does that make it sense that you need to take it at this point in time? It doesn't necessarily need it at that point in time. And you gotta have to add in things correctly. There's certain patients who are not able to tolerate glutathione, or at least sulfated-based products. And so in certain cases, utilizing N-acetylcysteine or using glycine may end up having to work better. You got to think about how what glutathione is, 3 glycine pieces put together. So utilizing glycine may end up having to do a better trick in helping them to manage these things and then supporting it correctly. But all of it all is still fatty acid because let's just talk about methylation for that matter. Everybody talks about MTHFR and the methylation process and all these things. If you look at the methylation process, you have to talk about methyltransferase choline pathway. The reason that you end up having to have that particular pathway is to create creatine and phosphatidylcholine. So, and that entire process as well is to recirculate homocysteine as well. But thing is, if you end up having to add in methylated B vitamins because that person actually has a methylation issues, all you're going to be doing is cranking a broken wheel, and that person's going to be feeling like crap.
Exactly.
And the reason that methylation process is basically forced to be blocked by the body. And this is what the body does to prevent additional damage that goes on because of infection. Virus particles, for instance, end up having to hijack the methylation process for them to replicate inside the body. So what the body's going to do, it's going to shut that methylation process down. And that's a key piece that a lot of clinicians don't think about because they think that methylation is a good thing. It is a good thing. But when are you applying that? That's the reason why people get confused or they feel like crap after. Like, I took all these methylated B vitamins and all these things, but I'm still getting sick. I'm not getting it better. Matter of fact, I got worse.
Right.
Why? Because you're trying to negate the work the body's trying to do. Instead, you're just basically trying to push that through because you don't know much as a clinician and then trying to do so. And I'm speaking as and humbly as I can because I made that mistake as well. But you have to really look at why methylation is so important and how that fits in and when to utilize it correctly. If you're dealing with an underlying toxicity, you cannot be cranking that methylation process right after that.
Which also, we know that B vitamins are essential in our body's detoxification. Like we have a high need for B vitamins in liver detoxification. We know this.
Yep.
I'm almost in tears because I needed you to say what you just said about glutathione and B vitamins, because I think that right now they're becoming so popular. And my clients are the people who have been to like a million practitioners before. They never feel better. They always feel worse. And then they're told you're just not doing the protocol right. They're told, oh no, it's just because, I don't know, your body's different, but it's really not. It's that in all of these things, when you're boosting, like you're saying, the function of methylation, or you're boosting the function of detoxification, you can't write a check that you can't cash, essentially. And I always say to my clients, I'm like, I don't want to give you glutathione right now because I don't want to instigate a war that we can't fight. So you have to know not only, and I know in medicine, there's always the phrase like the dose makes the poison. You have to know also, it's not only the dose makes the poison, it's what the condition of the body is to accept whatever the intervention is. And most people do look past that. Even functional practitioners who I love so freaking much still look past that. And I have very few clients who can come to me in the condition they're in and immediately accept huge doses of, methylated B vitamins or accept glutathione right away. They wouldn't be coming to us after being to a bunch of practitioners if those cookie cutter protocols worked for them. And it's very obvious why they don't. One major barrier that I see with my clients is their ability to get comprehensive and functional lab testing. I am so excited to introduce our podcast sponsor for today's episode, Inside Tracker. Inside Tracker is more than just a lab company. They help to personally select the exact labs you'll need to have a really comprehensive view of your health. And they will actually send someone to your house to get those labs completed. Once those labs are completed, they will go into your Inside Tracker dashboard where you will get insights into how these labs are important and what changes you can make based on those labs. The labs that are run are extremely helpful for those who are not able to get their doctors to run every lab that they need. I've been using Inside Tracker with my clients and found amazing insights from their professionals. Inside Tracker also integrates with apps like Apple Watch and Aura. It can also integrate with your DNA testing to give you more insights on that as well. Whether you want to improve metabolism, heart health, cognition, sleep, stress levels, Inside Tracker helps to reveal the exact areas of your health that need improvement. One other barrier I've found with clients outside of getting prescriptions for those lab tests is actually being able to understand and interpret. So that's why I find Inside Tracker so incredible. The Inside Tracker scientists have sifted through the research so that you don't have to. If you want to test, not guess, when it comes to your health, save 20% on all of Inside Tracker's plans with my exclusive deal. Go to insidetracker.com/quietthediet. That's insidetracker.com/quietthediet for 20% off of any Inside Tracker plan. You can find this link in the show notes.
Yeah, exactly. And then let's talk about vitamin D. That's another thing that I end up having to get riled about because everybody's like, oh, you know what? They have deficiency in vitamin D. Let's give them more. What if I told you giving additional vitamin D causes more inflammation in that person?
Let's talk
right?
about it.
Let's talk about it. So when you, in a healthier response, vitamin D end up having to be increased activation of your entire immune system, and there's many different functions that goes on. It also helps with the autophagy and creates an anti-inflammatory effect. However, when you talk about a root cause aspect and there's an underlying issue which is causing cell danger response, or let's just say you actually have mold toxins for that matter, or viral infections, giving heavy amounts of vitamin D prolonged period of time, short period of time is fine, prolonged period of time, and I've seen clients that come in taking 5 to 10,000 units of vitamin D on a daily basis, and then having to be told by the doctor saying that, hey, you're still not increasing your vitamin D level, or at least a 25-hydroxy, is because of the fact that when you're dealing with a root cause issues where that particular viral or even Lyme disease or even mold toxicity, is that addition of that actually increase the inactivation of 25-alpha hydroxy pathway, and it actually end up having to cause more inflammation, and it can lead into autoimmunity, right? And then you have a anti-folate receptor antibodies as well, so that's causing more problem. So does giving more vitamin D make sense? Absolutely not. You have to looking at and ask the right question. Why isn't that vitamin D increasing? Is it the gut issue? Do they have an actual genetic SNP? Like for instance, I have a genetic SNP issues that I cannot absorb vitamin D correctly orally. So you have to go outside to get sun exposure. So I basically tell everybody that I'm a highly emotional houseplant, right? That's basically where I am, and I have to get it done. You get this vitamin D that way. Or is it the fact that you have actual mold issues or underlying Lyme disease that's progressed so much that actually puts a negative effect on the vitamin D receptor that you cannot absorb vitamin D correctly, right? Or at least converting it. So that's one. And number two is you should also looking at calcitriol level. If the calcitriol level is increasing while the vitamin D is decreasing, you have a big problem right there, okay? And then when you're talking about levels of other things of that nature, like Th17 increasing, that's a perfect scenario for autoimmunity to occur. And you could measure these things 10 years before actually happening. But are we talking about that? No. What do we talk about all the time on Instagram? Parasites.
Why is everyone so obsessed with only parasites? Everyone's only talking about parasites on Instagram. It's such a thing. That's so interesting. You said that. I feel that way too. SIBO and parasites are the two things that I feel like are the most talked about in the gut world. Is it because there's quantifiable tests for it, so people feel comfortable talking about it more?
Not really. There's a particular supplement company.
Yes.
Not going to mention any names again.
Yes, yeah. That supplement company. Yes, exactly.
Yeah, that particular
I actually like their
company.
supplements, but I know what you're saying. Yes.
I mean,
yeah.
Please believe me, I use them as well. But the thing is, there's a place and time when to utilize it,
Correct.
and then when you orchestrate and adding into someone's therapy for that matter. But the thing is, that main focus was being taught is that parasites are the root of all problems. That parasites end up having to harbor mold toxins on top of Lyme, which is true, okay? But when you actually have an underlying issue for that matter in terms of the mold, colonizing mold and suppressing the immune system, right, creates perfect environment for parasites to thrive.
Exactly. There's one step further back in the root cause, and I want to talk about mycotoxins with you too. Mold. Yeah. I had mold toxicity too. It's what a fun time treating mold toxicity. It's very enjoyable because, like you're saying, it's not a very straightforward protocol for anyone. There's not any two people who are going to get the same mold protocol because we don't know how the body reacts. And I love that my doctor at the time said to me, she was like, if you have a Herxheimer reaction for 2 months, it's no longer a Herx reaction. It means what you're doing isn't working for you. It means that you need to change the course, basically. How concerned should we be with mold? Like, is it that everyone who encounters mold is going to have mold until they eradicate it and they have to take binders? I obviously know that's a leading question because I know your opinion on this too. But like, how serious can mold toxicity be? How concerned should we be? Let's talk about it.
Mold, we got to understand why mold is there. Mold is part of our entire microbiome. And we keep forgetting to think about what our microbiome is. Right? We're supposed to be evolving together, living together synergistically. Is that when you actually have an underlying issue of epigenetic problem in your body, especially cell membrane damages, we'll discuss what causes cell membrane damage later on. Cell membrane damages could be dealing with stress response, right? Poor methylation, we'll talk about that as well. But all these things are part of a epigenetic and environment, right? If you're talking about trauma for that matter, that also impacts in terms of how your mitochondria is performing, and as well as your cell membrane. So all these things are impactful in that sense of it. But when you talk about the mold aspect of it, it is part of our ecosystem. However, there are certain molds that are very toxic. Mold in itself, as long as you don't provoke it, it's going to be everywhere, right? But if you provoke actual mold, it's going to release mycotoxins. Right? So mycotoxin is a mold toxin. And depending on where that particular mold toxin is originated from, it's going to produce different things, right? So trichothecans is a type of group of mold that are very toxic and that can be very impactful within a damaged building, wet building syndrome. That's what it's called. And it can be very harmful for your health. It can lead into cancer, DNA damages, as well as causing immune suppression, all that. And so there's different levels of mycotoxins as well. And talk about gliotoxins. Another thing that I like to talk about is mycophenolic acid, MPA, right? There's a particular drug called mycophenolate, right, or Cellcept, been utilized in anti-transplant medication. Where did that derive that from? From mycotoxins called mycophenolic acid. There's a particular popular drug also, statins. Statins are mycotoxin, right? So people don't realize that there's a particular mycotoxin derived from red rice yeast. So all these things are utilized, and there's a particular function in what it causes in the body. It can be very helpful, it can be and such. But the thing is, it's that powerful of impacting how our entire cholesterol cadre is actually forming, how our cell membrane. It can also cause nutrition depletion, right? It can actually alter the entire gut microbiome, as well as our immune system, and impacting the liver and your bile as well, right? When you talk about bile and liver, goes hand to hand, especially when you're trying to get rid of mycotoxins. The mycotoxin, in terms of how it gets detoxed in the liver, follows the same process of hepatic recirculation, like estrogen metabolism. And so female clients, when they have to deal with high estrogen dominant symptoms, right, and you're dealing with mold toxicity for that matter, or we suspect that that person is dealing with yeast overgrowth, they can't detox estrogen correctly. So giving DIM or all these things to help with the phase one, does that make sense? Partially. But what do you have to do? You need to support the gut microbiome. You need to support the bile, right? You need to make sure that person's pooping correctly. So all these things needs to be put together so it's where you have an orchestrated effort in terms of getting that person corrected. So this is the reason why mold can be very impactful in that sense of it. And you got to find out which type of mold as well. And that's one of the things that I tell patients about, that you need to spend the right amount of money on some of your resources to order the right mycotoxin testing. Yeah. I do not recommend utilizing antibody mold testing because it's just look at the shadow in itself. It doesn't give you the actual specificity of the mold issue.
The strain. Yeah.
Yep.
Totally.
You have to looking at the urine mycotoxin. There's a particular 2 tests I only recommend doing these days is real-time labs and Bible wellness. Right?
Totally.
So
yeah. I think those are the only 2 that most of the doctors that I'm working with are recommending generally use too. So with mold toxicity specifically, I think if you were finding out information on Instagram about what to do if you had mold in your home, I think the first thing people would be told is go get a bunch of binders and get the mold out of your body, suck the mold out or something like that. Can we speak to why that approach might be not effective and or dangerous to just take binders?
Yeah. I mean, first off, if you suspect that there's mold issue going on in the house, just don't assume it, get tested, right? It
Testing,
sounds like
yes.
it sounds like a STD testing.
Exactly. Exactly. Don't get tested and then share your test results with all of your friends and family
Yeah,
who've been
exactly.
around you in the home. Yes.
But anyways, you need to get your house tested and then find out what kind of mold it is, or at least mycotoxins you're dealing with in the house. And I don't recommend ERMI at all these days, or at least to not just relying on ERMI, but you're also looking at surface testing, because just relying on ERMI, depending on the airflow and where you are testing, that results can be completely skewed. So I don't really recommend that. And then on top of it's not very sensitive to detect a lot of other things.
Totally.
So I don't really recommend it.
So just actually get it tested outside of your body. And then if you're going to get mold testing inside of your body, learn the strain first before arbitrarily throwing a bunch of binders inside of your body.
Definitely. I mean, there's different ways of handling it. I mean, obviously, the reason that a lot of people even talking about getting their home tested because they don't feel well and they come in, and then once we get the urinalysis done, they're dealing with mycotoxins. And then we have a discussion of, all right, these are potential places they get exposed to, either your work or you're from home or anywhere they end up having to spend more time on. Because even mycotoxin-wise, just because you go into a moldy house, right, does not mean that you're going to be having symptoms, right? Even if you're dealing with HLA genotype, those are the particular patients who actually have more sensitivity dealing with mold issues. But that doesn't mean that you just go into a moldy house coming out. Does that mean that you're going to have forever mold issues? You may have a little bit of allergy issues or other histamine response, but that's not going to cause major issues there, right? So already that person's coming in to have issues, then you get them tested in terms of your internal mold issues. Then if you're suspecting there's a exposure going in the house, get your home tested, results, then get your home remediated. And during the remediation process, or even if you decide to spend the money in a remediation, because I have some clients who just decide to, you know what, I'm going to pack up and leave.
That's what I did, by the way. I bounced. Yeah.
Right. So, like, especially in New York City, if you don't own your place, and
who of us does? Exactly.
Exactly. So, yeah. I mean, you got to be just packing up and moving. And
I literally was packing my stuff. So there's still stuff that I have not touched. I was like wiping things down and putting them in plastic bins and going crazy. I will tell you, I lived in the apartment and was noticing my symptoms were more like histamine symptoms from the mold specifically. And it was very coincidental that like everyone got COVID at the same time. I was like, great, we're all histamine and having a great time. But I walked into it was such a good apartment. That was the problem. And it was on Fifth Avenue. It was just like it was like the best location. It was an amazing apartment. So much so that I lived in the mold for an extra year because I was like, I can't leave this apartment. Like you can't leave a good New York City apartment. And I walked into the room, and at one point I walked in and my husband was like coughing up a lung, and he's a very healthy person generally. And like I think he's had a cold like once our entire relationship. And I was like, it looks like we're in the movie Interstellar. He can't breathe in this room anymore. It's time to go. And so we did leave, but then, his body reacted completely differently than mine because I had all this, life, nervous system dysregulation, all of these things. And I was vegan for 10 years before. So I lacked a lot of nutrients and a lot of support to move the mold out of my body. And he did not. So he really didn't have any mold toxicity, aka you can be in the exact same environment, but every single person's body is going to take those in, or like you said, provoke them or be provoking, inside of your body in completely different ways depending on who you are. So like you said, it's more important to actually see what your symptoms are and test and understand it, because it wasn't necessary for him to go through a full mold detox, whereby for me it was very necessary and super unpleasant, by the way. Just didn't love it, obviously.
Yeah. No, I had the same experience as well. So 2019, I suspect that there was a mold issue going on in the apartment that I was living at before I used to own a house. But, after dealing with heart attack, all the health issues, I was like, you know what, I'd rather just downsize everything and then, live in a simple apartment and living at that. But I moved to a very older apartment in New Jersey. And there was the moisture level at that place was 70%. Just humidity, just moisture alone was 70%. If you go above 50, you have a high risk of actually developing mold growth and all these different other issues in the environment. But that was one aspect of it. And then when I got my mycotoxin testing done, very high. I forget which one. It was high levels of aspergillus and penicillium and top of ochratoxin we actually deal with. So those are the key issues. But then when I was actually looking at the apartment and getting tested, it was just filled with mold. Especially the air duct, because the entire air duct was just...
It was my HVAC too. That's where it was a lot in the HVAC.
And it's not even just a standalone HVAC just for your apartment. It's the entirety of the system. So trying to argue that with your landlord and trying to get that issues done.
Oh, we lost like terribly, by the way. My building was built in 2015. It was a new building. Like it was a new, super nice building and still had that issue. So it also can happen. It doesn't matter how like it can happen in many apartments, especially again, if you have those units. I also had an air doctor running all the time. It just it really depends on you, the state you're in, how your body interacts with it. And so I would never recommend someone going through an at-home mold detox protocol. If you suspect it, always work with a practitioner. It's very delicate. And like I said before, picking a fight within the body that your body can't then wage can create to more symptoms. And a lot of the symptoms I see my clients experiencing from mold toxicity are really mast cell and histamine related over just like the allergy kind of symptoms. They're experiencing these full body symptoms, temperature regulation issues, brain fog, dizziness, even dysautonomia issues and things like that, much more so than just the allergy issues. So this is something that I really recommend. Any form of detoxing too, I really would recommend working with a practitioner. And I know that that's a really unfair thing to say because it's not accessible for people. So what I would like to know is, Dr. John, can you let people know, like, what are some accessible ways to just promote in a safe manner healthy detox and drainage, but without provoking huge issues within the body?
That's a loaded question because depending on it's hard because depending on a patient, and I've had patients who are very sensitive and they end up having to be reacting to everything, including PC when you give a phospholipids, because it is supposed to start to help mend the issue within the cell membrane, and detoxing is that some people are just too sensitive in dealing with it. So going back to the same basic point is are you testing correctly? And the second thing is, again, test, don't guess. You need to test. And then afterwards, what else can you do to help to alleviate the entire drainage pathway to detox correctly, right? You don't have to spend a lot of money on a detox protocol. As long as you actually have the right labs and a plan, it's less expensive. Let me put that as a correct way. It'd be less expensive rather than trying to throw the entire monkey wrench at it and doing so. So that's the reason why working with the right practitioner makes really sense, right? There are certain practitioners who utilize IV phospholipids and as well as using IV sodium phenylbutyrate. And these clinicians are able to clear mold toxin out within 3 to 6 months because they have a hyper-focused testing modality, right? There's very advanced labs like IGL, which is only available in Germany, but those MDs, functional MDs, are able to order those testing, and then they could do IV work in the office, and they could get you corrected within 3 to 6 months. But those are inaccessible a lot of times because, one physician that we work with, she's in Morristown, New Jersey, but she's only available at that point. But I have many patients who are living in overseas, and including during the United States, who travel there to get it done. But again, that is a resource that you may not be dealing with because you have to move there for 3 to 6 months. You have to find a place to live, aftercare, who's going to be taking care of you. All these things has to be all taken care of. Luckily, I was living literally 30 minutes away from her at that point in time, so it was easy. But Absolutely. A lot of people are not. So people who are not able to do that, I also give people virtual consultation, and I give them entire protocol to do it. The first thing I still do is the foundational care, drainage pathway. Are you eating well, pooping well? How are you taking care of yourself? Is your environment clean enough, right? That is the core piece that you should really focus on even before.
And those can be done at home before you're doing all this testing and everything. That's involving things as simple as walking, dry brushing, being in sunlight, like the most basic essentials, eating foods that are as nourishing and regulating when it comes to our nervous system, blood sugar, all of those things is possible too. And those things can mostly be safely done too, like things like walking and, even again, a little dry brushing, a little oil massage. These things are less forceful also than those supplements and things like that. But
Absolutely.
The first place to start is those lifestyle modalities and is never those supplements, because that's what you would tell people to do before they even come to you anyway. So they can get to work doing those things first.
Absolutely. It doesn't cost that much, right?
Exactly.
I mean, that's basic the work that you have to do. And one thing that I posted on Instagram 2 days ago is that people think that just getting involved with a practitioner is going to just fix the entire problem, right? I could show you to the water, but you have to drink it. I'm not here to force feed you the water. You need to take care of yourself, right? I'm there to help you, coach you. I'm going to help you, really design the right supplement protocol and all these things. But then that aspect in terms of you having the right proper sleep, you dry brushing on a daily basis, you doing all these things, that's on you. I can't be there for you. And that's the key missing piece.
And no supplement or medication is a replacement for those movement practices, those breath work practices, that nervous system regulation piece. Like there is no replacement. And by the way, I wish there was, but there's no way getting around what I always like to say, being human. Like you have to be human first before all of these things. So there are things you can do if you suspect these things. If there's financial accessibility issues for people, there are things you can start to do at home before you get all this testing, which can be extremely profoundly helpful. And so are the protocols profoundly helpful. But there are things you can do at home that we just listed to just get things moving. And I think one thing that we both so firmly believe in and so strongly speak about is mineral repletion. Also making sure you're getting electrolytes in, because that is at the base of our cells, the base of every single function of our body. And that is something that we are all sorely depleted in many minerals. Some of us have a little too much of one or the other, which you can also confirm with testing, of course. But making sure that you're, like you said, hydrating properly with minerals is essential for everyone.
Absolutely. That's number one. And then also adding in the right amount of healthy fat. I mean, that's a key missing piece that a lot of people are lacking in, right? Because what are we happening to do nowadays? And we go out to eat. And even if you decide to go to a very expensive restaurant in New York City, they still use canola oil or any of these regular conventional oils are very inflammatory. And those end up having to be impactful on your cell membrane and damages it. Because what happens is that particular hydrogenase oils, especially omega-6 for that matter, you need linoleic acid omega-6 to help support the inner membrane of your cell membrane. But it's just that when you end up having to constantly overload yourself with hydrogenase oils, those are being impactful in causing fatty acid deficiency. Never alone, it causes leaky cell membrane. Also, taking too much omega-3 as well, this is a great balance. Taking too much omega-3 can also cause leaky cell membrane as well, right? So all these things about, you got to eat fish oil or take fish oil all the time, I don't recommend that anymore, right?
Neither.
Before, when I was doing my fellowship training, and that was a key thing, it was always recommended. Anyone that comes in with adrenal issues or hormonal problem, put them on 2 capsules of omega-3 twice a day with food. And that's what you should be doing. If you have a person dealing with rheumatoid issues, pump it up to 12 capsules. That was the entire protocol I was taught.
Wow.
But what was the reason that rheumatoid issue improves after adding in 12 capsules? You're suppressing the immune system.
Right. And that's not the goal. It's to suppress the immune system entirely. Right. Exactly.
Right.
And I think, so I have a philosophical question for you. How do you grapple with the fact that we live kind of in an environment where we're going to encounter things, especially in America, everywhere in America, but people go to Europe and they eat food that doesn't have glyphosate in it and they're not as sick, and people feel this way. Like, how do you personally grapple with the fact that we live in an environment that's kind of incongruent for health?
That's a tough question to answer. The reason being is what can you tolerate, right? And the second thing is, how much can you afford to spend money on all the clean, expensive food.
Well, you basically have to spend money to fight the thing that, like, we all acknowledge that there's problems, but you just have to like do the opposite of what is conventionally accepted, which is usually very expensive, like you're saying.
It is. It is. So if that's the case, if the money is tight and all these things, I'm not saying to go out and spend hundreds of dollars on all these food that you think that is healthier. In many cases, even though they might be marketing as being organic, it's really not healthy. It's sometimes packed with sugar, right? That's one of the key things that I learned. Even like I went to Whole Foods this morning. Because I didn't get a chance to pack my lunch, so I picked up a salad and I was going out, and then they had a breakfast sandwich there. And on the breakfast sandwich, on the actual label, it says biologically modified.
Why do they say that? That's interesting.
I don't. And it's cost $7 for that breakfast sandwich.
I was going to say, it's like a $10 breakfast sandwich that you literally could just get from a bodega for $3 for no reason. Like, just get it from the bodega instead. Exactly. Yeah.
I mean, I'm just like, what is this going on? So again, it's just like, just because you spend a lot of money in Whole Foods doesn't mean that you're getting healthier food, right? That's the thing. So this is what I would recommend you doing. You got to be very diligent about it, right? When I was sick, and thank God I was sick, because if I was not sick back in 2015, I probably didn't even shift my entire trajectory in terms of doing functional medicine the way that I'm doing now. Is that when I was sick, those moments when I was sick at home, I didn't really go out. And so what I would do is I'll just go grocery shopping, bring it home, and then I'll just meal plan the things that I'm going to be eating, because I lacked the energy, and Sunday was a rest day for me anyway. I just cooked a bunch of meals, and easy thing that I made was stew or chili or something on that line.
Yummy.
And just made it easy for me to eat, right? And then just add the healthier fat and then all the nutrients that you need to do it. So all these things can be controlled as long as you're diligent and you have a plan to get your diet corrected. Right? That's the key thing. If you don't have the resources, you don't have to spend hundreds of dollars going to Whole Foods or any of these places. You could still go to a farmer's market, right? You could still go to a local grocery.
Yeah,
exactly. Yeah. Just because you didn't buy a organic grass-fed beef doesn't mean that the other beef is worse. It's that's the thing.
I had this client this morning who she's from the Middle East, and she eats like the Persian cucumbers as opposed to the larger cucumbers. Yep. But she goes to the supermarket and she's been very concerned about plastics and PFAs. And she was like, but the Persian cucumbers are always wrapped in the plastic. And I'm like, I totally and completely hear that as a legitimate concern, especially if it's sitting out in the sun or something like that. But I'm like, I almost think the benefits of you consuming the cultural food for you that feels more like biologically appropriate for you and is safer for you and feels good might be worth it. But it's like everything's a little bit of a negotiation you have to make. Like, what's the price negotiation in your head? What's the chemical negotiation in your head? Because to be perfect all the time in this society is going to be hard. Like you're saying, unless you're literally going to a supermarket that doesn't use any plastics or paper, and then you're also eating at home every single meal. So it's never going to be perfect, but like you're saying, just doing the best you can with what you can. And at the same time, not maybe getting too crazy about it, because it's like you can't prevent 100% of things, and you'll be able to tolerate some things more than you might be able to realize you can.
Exactly. It's nuts. And all these health influencers end up having to, this is the one thing that I got really annoyed about. And this is just a story, really interesting story, is that I was at the recent, I'm not going to mention which seminar it was. I was at a seminar, and I went out with a whole bunch of functional medicine providers like myself. Went out for lunch. So we were there, and then we went out for, obviously we had an hour lunch break. We go out for lunch, and we sit down there. Our lunch is still enough, but then we sit down, and then all these practitioners end up having to ask the waiter, do you use canola oil in your cooking? Can you replace that with butter? I mean, for Christ's sake, the person's trying to do their job and do their work.
Right. They're like literally working really hard. Like, please don't, you know what I mean? Exactly. And also, by the way, the answer is, unless they specify, yes, they are using that. So you have to make your calculated risk. Exactly. Is it worth it then for the sense of community to just be with your friends and eat this one meal, or, I think that's the give and take. And I think it's easy to hear all this and get really afraid from even that nervous system perspective to feel threatened by our environments. So I think it's just do the best you can with what you can, and you'll be better for it. And that's all. And that's all you can do. Exactly.
And it's fine. And I have a friend, good friend. She doesn't go out to eat, but she cooks her whole meal, right? And she's very happy with that. And she mainly spends money on getting the healthy ingredients and cooking at home. And then she spends the other resource that she has to enjoy her life. And that's perfectly fine.
Totally.
There's no right or wrong way to do it. But do not stress yourself. Any listeners out there, do not stress yourself that you need to have this perfect environment to heal. Perfect environment should be clean house is one thing, but just because you need to spend an XYZ dollars to get the most high-tech HVAC or air doctor possible, no, not at all. Open up the window. That's the first thing you should be doing.
Exactly. I thank you so much for that refreshing perspective. I also have to tell you this very funny thing, which is that a new hot thing on Instagram is that a lot of, I won't say the type of healthcare professionals, but they're a style of nutritionists who say, you don't need a detox. You have a liver and kidneys. Why would you need a detox? Which I always found very funny because obviously you're focused on optimizing your detox function and there's so many different components of it. I just wanted to add this to your list of vegan Karens and your list of people to hate on social media, but not as humans, just their one post about that.
No. Yeah. I mean, this is the way that we were taught in school. And that's the reason why. Right?
Exactly.
And it doesn't give you the full information. Yeah, you have a kidney and liver, but then also those kidney and liver are very sensitive. Reason being is filled with mitochondria. And those mitochondria are very sensitive to toxins. And if the mitochondria is not functioning well, you can't detox well.
Exactly.
The same point goes back to what are we doing with the mitochondria and what are we doing with the cell membrane? Still support it well with food, with the supplements you need, especially I recommend Body Bio PC and Bowels Oil from them.
Best.
And then if you can have the resources or at least the practitioner you can work with, order that red blood cell fatty acid analysis, really looking at what the imbalances are, take care of yourself very well. But all in all, you don't have to spend a lot of money to be healthy.
I love it. That's our final message. That's the best message we can possibly have. Dr. John, you're the freaking best. Thank you for coming on today, laughing with us, educating us so much. Where can people find you and how do people work with you?
Yeah, absolutely. So you can find me on Instagram, Dr. John PharmD, Dr.JohnPharmD. And my website is drkimwellness.com.
And put the links.
And and also I think I gave you a discount link for your followers to make an appointment. So I will send that over to you as well. Heavily discounted. $89 for 45-minute, consultation with me. I only give to only selected people, but for your listeners, I'll be happy to provide.
You're a Quiet the Diet king. You're the best. Thank you so much.
Thank you. Appreciate it.